Well, let's stay on that health beat here for a moment. The latest concern from the top health officials in our country: loneliness. The U.S. Surgeon General is calling loneliness a public health epidemic, saying it poses health risks as deadly as smoking up to 15 cigarettes every single day. And loneliness, he said, costs our healthcare industry billions of dollars every single year. For more, here's Charmaine.
Yeah, Jana, many of us have been there. In fact, half of U.S. adults have experienced some type of loneliness, and experts say it could lead to severe health risk.
Loneliness is far more than just a bad feeling.
In this video posted on social media, U.S. Surgeon General Vivek Murthy introduced the first advisory on the epidemic of loneliness and isolation.
In-person matters. Connecting online has its place, has its value, but it's not a substitute for in-person connection. We really do need both.
With the rise of technology and social media, there are concerns about the impact of social isolation.
There have been concerns even pre-COVID with the lack of social connection or the decrease in social connection that people are experiencing because of technology in our lives and how the community has been set up.
According to the report, Americans spent about 20 minutes a day in person with friends in 2020, down from 60 minutes daily nearly 2 decades earlier. With the loneliness epidemic hitting young people ages 15 to 24 especially hard.
Loneliness is more that feeling of being alone and like people and not connecting, even if you're in a room full of people. And that can happen for people as well, especially for those who maybe lost some social skills during the pandemic or didn't have a chance to develop them.
While about 1 in 2 American adults of all ages and backgrounds report experiencing loneliness, experts are now calling for more pro-connection policies to increase education on the benefits of social connection.
It's extremely important that we prioritize this for ourselves, and that those of us in medical and mental health, that we also ask our patients and work with our patients on increasing that now that we have a better understanding of how important it is.
Charmaine Nero, KARE 11 News.
So there are ways you can start. You can use online search groups to find meetups all over our area, right here in the Twin Cities. Or you could try a meetup at your place of worship or at the library, or there's lots of adult learning classes that are around our parts. And there's one more thing that we can all do that is the #1 suggestion is put your phone away when you do get into a social setting. Soak up the people and the moments in real time. It goes a long way.